Apparently a lot of people are interested in Lightning Scheduler, and especially like this last week, everyone was signing up. It is a very fascinating tool. We're really excited to share about it. Corinne, Michael, and myself. Mel can't join us. Unfortunately, she has a conflict, but she's with us in spirit. And we do have a special guest joining us, Michael. Lightning Scheduler is an interesting beast. And I don't say that lightly. And even to this day, I still have to go back to diagrams. I don't know about you, Corinne, but I still have to go back to diagrams and go, what?
Wait, yeah, how is this working again? It is a interesting, fun new tool, but there are so many like different and fun applications for it that like it's worth like learning all of the things, but it is it's posed some challenges as well.
Yes. All right, it's 12:02. We're going to go ahead and kick it off. I'm quickly looking. Paul is on the line. Thank you, Paul. And I would introduce you, but I will butcher your last name. So, Paul, if you want to unmute yourself and just say hi to the group before we kick off the meeting.
Yep. Hi, everyone. My name is Paul Hittinger. I'm a Salesforce solutions engineer. I specialize with our Service Cloud and Lightning Scheduler Field Service Lightning products.
Awesome. Thank you so much, Paul, for being here. We also have Michael Connolly. If you want to introduce yourself real quick, Michael. We have a slide deck, but we got a lot to cover, so I figure we'll get the intros done now. So, Michael.
Yeah. Hi, guys. My name is Michael Conley, consultant at Penrod, and I've been in the space for quite a while, both healthcare, IT, and Salesforce.
Awesome. We're very happy to have Michael and Paul here. Having Paul representing Salesforce is a wonderful added benefit to this. We are recording this and we will post this recording along with a slide deck. We have a lot to cover. It is Lightning Scheduler. None of us are experts. I think Paul is the only one who can claim the true Salesforce expert card. It's constantly evolving, and every upgrade that comes out, there's something new and exciting with it. But that said, throughout this is a discussion. This is a interaction. At any time, if you want to throw a question in chat or chime in and ask questions, please. That just adds to the value. And if we don't cover certain things, we have resources and links in the slide deck that we'll be sharing out to everyone. So you'll have that at your disposal for, if we don't get to certain slides, you'll have that. So I'm going to go ahead now and share my screen. Okay, and can you confirm, Corinne, for me that you see the slide deck?
I can.
That was a yes, you can?
Yes, I can.
Okay, awesome, thank you. And please, anyone, if I start talking too fast, please do not hesitate to let me know. So welcome, this is the Salesforce Healthcare User Group, the second one. It's a community group. So what that means is that we come together as mutually engaged people with Salesforce. There's a lot of consultants on the call as well as customers of Salesforce. But this is really geared towards those who have purchased Salesforce or working with Salesforce, and we're helping each other out. Today, we are focusing on Lightning Scheduler. A little bit more about who is your co-leaders here. We have Mel, who unfortunately couldn't be here, myself and Corinne. Together, we have a lot of experience with healthcare and as it works with the Salesforce components. And I'm going to keep moving because we've got a lot to cover. Michael has already introduced himself. So let's jump into Lightning Scheduler. Lightning Scheduler is actually part of Field Service Lightning. I don't know if people are aware of that or not. It is so if you work with Field Service Lightning and then you go to look at Lightning Scheduler, you're going to say, this looks very similar. That's because it is a part that was actually taken out of Field Service Lightning. I think part of the biggest challenge, and Corinne and Michael and Paul, you can probably chime in on this as well, is that getting used to the vocabulary. The terminology can be a little bit of a challenge, so we're going to be going over repetitively on that. The first thing we want to point out is that outbound scheduling is when you as the Salesforce user, you're the customer, the client, as it were, working with a customer and you're scheduling the appointment. That's outbound. Inbound scheduling is when the customer is scheduling an appointment with you as a client from a community or so forth like that. To put some context, this is a healthcare user group. The story that we're going to use is this is a call center that schedules patients from multiple location physician practices, and their primary focus is diabetes patients. And they have two primary types of appointments. They have the new patient intake, and then they also have weekly nutrition meetings. So we're going to frame things in that type of user story as we have this walkthrough. So we're going to talk about your scheduling appointment. We have where, when, and who, right? And you're thinking about, just like any regular appointment scheduling, you have locations, where you're going to have it, what's the time and when and who's going to be at the appointment. You might also think you may have routine topics and how long is the meeting, what's your bumpers on that, and who's authorized to attend those meetings. Well, in Lightning Scheduler parlance, where is a service territory operating hours, when is work type groups and work types, who is a service resource and skill. Another way of looking at, when we're looking at the where, a location, service territory. Hours is can schedule appointments, operating hours. When, visit type groups is a work type group. A visit type is considered like a template of what that visit should look like. It's a work type. Appointments are service appointments. Some of these are sort of obvious, some of these, not so much. Who is practitioners, your clinical team, they're considered a service resource. And also a service resource can be a person or it can be an asset. Clinical qualifications are skills. So what does this look like? When we're looking at a service territory, we're looking at a physician clinic or a nutritionist office. Operating hours, Monday, Wednesday, Friday, 8 to 5 could be what they use for, this is when they work with their diabetic population. Work type groups, it's an overall grouping. So diabetes new patient could be a grouping. And then we have nutritionists. But work types, we could have under a diabetes new patient, we have a diabetes new patient 30 minutes as a buffer. And then also part of the new patient could be a work type of nutritionist intro meeting. But then we can have other work types, could be the weekly meeting of nutritionists, weekly meeting 15 minutes buffer. Noticing a work type group is a high level. Work type is very specific to that appointment. Service resources, in this use case, we're having physician and nutritionist. And then the skills are, well, it's a physician, they're a medical doctor, nutritionist. It could be a nutrition certification that you need to have on that skill. So let's go to the definitions a little bit more, and this is from Salesforce. And I'm going to skim this, you all can read. So I'm not going to death by PowerPoint here, but we're just now talking about all of this leads up to the service appointment. That's the end product. When you bring it all together, you have a service appointment between your resources, your service resource, and the person who's at appointment. But all these different things, now you look at service resource as employee attendee, your skills, service territory, so forth. I highly encourage that when you start working with Lightning Scheduler, this slide and this slide stays very close, because this is where you're going to get lost. Where are you and how are you building all your different Legos that make up Salesforce Lightning Scheduler? Any questions on those definitions before I move into the order of steps? If you're completely new to Lightning Scheduler, this is a lot. And we are going to do a demo, FYI. Any questions in chat? Nope. Okay. So those are a lot. And I've been working with Lightning Scheduler for a while, and this is where I keep, even sometimes go back to my bucket list, and if something's not working, I'm like, okay, let me make sure I assemble this all together properly. And speaking of how to assemble this together, the general order of setup, Lightning Scheduler can be set up in several different ways. This order of steps is a logical sequential way of putting this together. So first off, there's a lot of permissions you need to set up and you need to assign and you need to open up. So that is, you can see that in the trailhead as well as the Lightning Scheduler guide. And then you're going to look at your operating hours and time slots. And something I think is really, really key, and Corinne, Michael, and Paul, feel free to jump in, but I think it's really key to understand is you can have operating hours for a location, and then you have operating hours for that service resource, that person, of when they're going to be at that location. Well, that sounds like, if you're scheduling an appointment, candidly, that's a dumb moment, right? You're like, well, of course. But when you start looking at how Lightning Scheduler uses the words, It's really easy to get lost and sunk into there. So that's something else to keep in mind too, is you'll need operating hours for the territory. And then we go to skills. You're going to create the skills that will be assigned to the service resources. Then you also go down to, we have our service territory. Now we have a service territory member, which by the way is a junction really between service territory and service resource. Oh, wait, now we need to go and do operating hours for the service territory member, which is the junction between the person and the location. So we moving this sequentially, build your location, build the person, then bring them together. Then you have your work type groups, which is your general heading, your specific work type, your appointment template, and then you assign the work types and work type groups to the service territories. Corinne, Michael, Paul, anything else you want to add to that?
Nothing for me.
Yeah, I mean, I don't really have anything to add. I think it is really clear that like having that definition guide handy and ready when you're kind of going through these different things is really, really helpful.
Okay. Now, we've just talked about, and we are going to show this in the demo, right? So this is not just, again, death by slide deck. And we do have some gotchas. If you're familiar with Lightning Scheduler, we do have some tidbits for you all as we get further in. Lightning Scheduler comes out of the box with 6 flows. Salesforce encourages taking those flows and modifying them to make them work for you. So that's awesome. They provide out of the box, you get scheduler, you get these. The 3 for outbound, which again, you as the client who has Salesforce scheduling for your customer, that's outbound. So you have new appointment, modify appointment, and cancel appointment. You also have 3 for inbound, and think community. You can put these out on the community where a customer can request an appointment with a physician because they've been newly diagnosed, or a nutritionist appointment. And then it's a new appointment, modify appointment, and cancel appointment. Completely customizable, great selection out of the box components, and that is part of the deliverable of Lightning Scheduler. Here's a data model. When you get the slide deck, feel free to go through it. I'm not going to go into this one, but do take time, go back to your definitions that we have for you, and then look at this and how it's built, and this will help start bringing this all together. All right, let's pivot to a demo. Here we have Penrod Health, and it's our demo org. So Charles Green is a fake patient. And I'm the call center, and Charles called, and Charles is like, I have a new diagnosis of diabetes, and I need to find a physician to work with on this. Okay, so as the call center, I have a scheduled appointment these appointments been set up, and I have the option to search by name. Like they may be looking for, oh, I heard Dr. Smith is awesome. Okay, you can search for Dr. Smith. Or I'm not sure, but I want to look by work type group, appointment type, or service territory. Service territory being your location. Appointment type is I'm a new patient diagnosis, or work type group. There's all the different combinations you can have, but I'm just going to go ahead and say, let's go ahead and click next. And this is what we've set up for the call center through Lightning Scheduler. And we've said, and they have the Lightning Scheduler permissions. We're like, oh, okay, we're going to have a new patient diagnosis set up. And when we flip next, it's like, well, how are we going to do this? Well, in the year of COVID, video phone is now pretty much a lot of how we're doing things. And now we're like, okay, well, where's the location? Now notice I put in Orlando. By the way, I live in Orlando, Florida. And I select the suggested drop-down powered by Google. And then they're like, oh, I can do 5 miles, 10 miles, 25, and so forth for the radius. And I have in here a diabetes management clinic, and these are the hours that I have set up, Monday, Tuesday, and Thursday. I click next, and then at this point, I'm like, oh, Dr. John Boxworth is available. Perfect. And now it's saying its next availability is 11/19 at 12:30, but maybe I actually want to look at what else is available. This is all completely definable with inside Salesforce and Lightning Scheduler. And I could skip this if I wanted to take the suggested first time, but let's say we're going to do this for next week, not on Thanksgiving. We're going to say for 9:30, Tuesday the 24th. Now I have the ability to review my service appointment, and I'm going to look at this information and confirm, and maybe I want to put in a description for the doctor's office, a newly diagnosed, I don't know, 11, 16. And if there was a subject I want specifically, I can put this information in. Any other information I want, I click on next. And now I am done. Now this appointment has been scheduled. I have a service appointments related list. And now I can see the appointments. You can see one I was messing around with earlier, and then the one I just scheduled. That is how it works. Very straightforward, and how you can have it interact in that environment. Any questions on that? All right, but Tina, how do we set it up? We have Lightning Scheduler Assistant that comes, setup assistant that comes out of the box. And Corinne, do you want to talk through this through here? This wonderful tool that makes our lives so much easier?
Yes. It definitely helps the process along, especially kind of walking through all of the different records you need to create. This setup assistant makes sure that you're creating them in the order that they need to be created in to like kind of have everything come together at the end. So going through this and going in order is going to make the schedule building process a lot easier. Essentially, it walks you through all of the same kind of setup steps that you go through in the guide. And it starts you at permissions. So it will prompt you to make sure that you're assigning permissions to the users who are going to be scheduling appointments. Then it lets you set the operating hours for the location. So back at the beginning, Tina mentioned that there's multiple places where you're setting and creating operating hours. So the first core one is going to be the hours that the location itself is going to be open. So are you going to show the record creation, or do you just want me to walk through?
I can actually pivot. So hold on one second. Let me hop this way.
Okay.
So we're going to go look at operating hours, and we can do, and this is what it looks like here.
Yeah. So you're basically just setting the timeframes that the facility itself is going to be open. These are, if you have a community with inbound appointments, then when they're walking through the scheduler and they see like the location, they're going to see the operating hours for the facility itself. So this is reflective of the actual location. So once you create your set of operating hours, it's going to have you create a service territory, and that is going to be the actual location record. So this is where you have your address, and then you're going to associate the operating hours record that you just created to this location. So now when you're kind of thinking about the different screens that we went through during the appointment setting, that screen where you chose the location, now we have the functionality behind that piece. So basically we have the location itself and then the hours that are associated to it. So then we go down to the people who are going to be working at that location. So first we create the resources. And like Tina mentioned earlier, there is the user resource and there's asset resources. So depending on the type of license that you have and your specific use case, you might have like actual people, human beings that need to have appointments scheduled with them, and they have their own schedules and kind of those types of things, like depending on the use case, if you're actually scheduling something for a doctor or a nurse. Another use case, you might not have a specific doctor or nurse to assign. It might be more of a like walk-in type situation or something where there isn't necessarily a dedicated physician or provider that's associated to it. So you might be utilizing the asset license type, which would allow you to create more of like a static non-user resource.
Another cheat to go in on that, and there's actually, it's later in the slide, is you have a user resource license, Lightning Scheduler user, you have Lightning Scheduler asset. But guess what, guys? So you can take a Lightning Scheduler asset, which is cheaper than Lightning Scheduler user. The difference is, what the key is, do you need to sync the calendar with a human being? If you have a resource that can change all the time, like it's a different technician every single time, think, we've seen this multiple times, COVID testing. You have a time you want to schedule, but you don't know what technician's actually going to be doing it. Well, that actually, and they don't need to sync their calendar. It could be contract people. You can use an asset instead of, which is a cheaper license than the user license, and still achieve what you're trying to achieve, because it's not unique to a human being. Dr. John wants his calendar synced. He's going to get a user license. But if it's constantly changing and turning, and you don't need to sync a calendar, and I use that as my litmus test. And I think that's an easy one. Corinne, what do you think? Like, remember, it's like, you need to sync a calendar.
Yeah, is there a calendar that needs to be synced? Does the resource, are they going to have access to Salesforce? That's the other piece to keep in mind, is that for the standard resource functionality, it does associate to a user in the system. So you do need to have a license for that person. So they would be logging in, having the appointment sync with their calendar, like they would be able to go in and like make updates to, whatever records they need to based on that appointment. So it's more so, is that, is it a static person? Are they going to have access to Salesforce? Is it someone who needs to have a calendar assigned to them?
Yeah, this is Mike. I think a good example, if somebody's familiar with Field Service Lightning, which is the sister product, is in field service. Then a resource is a person. So maybe somebody going out into the field, which would represent a crew or multiple people, where an asset could just mean generically a location. So your Florida location would just be one place. You don't need to dial deeper into the specific person that's going to be completing the work. Or you could even have multiple assets just representing rooms or like booths in one of those locations. So Florida may have 3 rooms, you have 3 assets to break it out that way, but it's not tied to a specific, Tina, Corinne, or Michael's situation.
Hey, Corinne and Tina, this is Sam from Torrent. I had a quick question around the license types that you can assign to these service resources. So for smaller organizations, this might not be an issue, but I think for larger hospital networks with hundreds of physicians, we've gotten some pushback from prospects. So I guess my question is, what type of licenses will allow a service resource to be scheduled? Or is it specific just for like an individual, or can we apply these to like community user licenses, or is it strictly for one specific license type?
You mean a Salesforce user license type?
Right. Yeah, because in theory, right, these are the physicians that working at these practices and these offices, so they would need to access the system under a particular license type. And is that like the user license type that you were just mentioning, Corinne, for Lightning Scheduler?
Yeah, so Tina, I don't know if you have more information to clarify on this, but
well, this is where we have Paul.
Yeah. Okay, good. I didn't want to call him out.
Right. No, I'm going to call him out. So,
Yeah, so you're asking if a schedulable resource needs a license. And the answer is, for a resource, no matter what's being scheduled, whether it's a resource or an asset, they will need a license. There's a resource license available. Mm-hmm. As far as access to the system, I would say we've seen a lot of customers that don't necessarily have those resources be schedulable as far as needing to access the Salesforce system. We do have calendar integration with this, and we can send all those events to like an Outlook calendar or something like that. So we have a lot of customers where those schedulable resources won't necessarily be in a Salesforce instance like you're seeing here.
So if I could just read that back to you. So these individuals that are going to be scheduled as a schedulable resources, assigning them this license just gives them the right to be scheduled, if I can use that terminology, but it doesn't necessarily give them access to the Salesforce system.
Correct, unless they have a different license, right? So they would need a license with a community user, for example. There has to be some type of user on top of that. So I think it's Sales Cloud, Service Cloud, CRM. So a lot of the users will have a full access license, and then we have a Lightning Scheduler PSL on top of that, which is that schedulable resource. If there were somebody that wasn't going to be interacting with the Salesforce instance, in your case, I would probably say you go with like a customer community and then a PSL on top of that. So they can at least access and view their appointments through a community. Some customers, they don't actually end up using that functionality, but that would be the licensing path for like a provider who needed to be scheduled, but didn't have access to a Salesforce instance.
Okay, so every schedulable resource needs to have a license associated to it, just to be a schedulable a service resource. And then if they need access to Salesforce on top of that, like it's a different license, and then they get the permission set license for the scheduled resource.
Yeah, it's kind of the inverse. So we have a SKU called the Lightning Scheduler PSL, which is for scheduling resources, right? Mm-hmm. That's not a standalone. It actually doesn't even work with just platform. So there has to be a license on top of that. So there's got to be a base license. So typically what we've seen customers do in the situation that you're talking about is there's a customer community license, which is probably the cheapest route you can go, like a login-based customer community license, and then that Lightning Scheduler PSL on top of it, right? So there has to be a user in Salesforce that's created, and that user has to have the license. So whether it's a Sales Cloud, Service Cloud, a Health Cloud, or whatever user that might be, to be a scheduler resource, you have to have a license. In your case, I would recommend going with like a customer community license, because that's going to be by far the cheapest. And then you pay for that Lightning Scheduler $25 a month list price or whatever to schedule that resource, right? So if they're never going to be interacting with the system, they still do have to have a license, but customer community would be the most cost effective. There is an advantage to setting up a customer community as well, if, just as a pure portal so they can manage their appointments, right? So if you look at John Bosworth, PCP right here, he can be a primary care physician. He can log into his portal, and that's where he goes and he sees all of his appointments in a holistic view. Those appointments can also easily be added to his calendar, so he might not need to go in there very often because there's a real-time bidirectional sync between his Outlook calendar, so that he's a schedulable resource. He doesn't need to log into that portal, so he's kind of managing that just from his calendar being updated, but he has the ability to with that customer community license, if that makes sense.
Yeah, I think so. Sorry to beat the dead horse here, but like to interact like with the system from a schedulable resource standpoint, you said they need a customer community license, and this is sort of like the cheapest alternative for them, right? Yep. The customer community license, and then the Lightning Scheduler permission set license, right? Yep. So if they don't need to interact with the system and we just need them to be a scheduled resources, do they still have to be a user with a different license?
If it's a user, they have to have a user with a different license, yes. If it's an asset, which is a different license, then no. But for individuals that are users that need to be scheduled, they do have to have a license in Salesforce, a user license of some type.
So if there's no community at play, and like I'm a physician and I just need to be able to be scheduled, that requires still me to have a user license. So what license would I be assigned?
Would you be assigned?
Right. Because I'm a service resource. I need to be able to be scheduled for potential appointments. In order to be a service resource, I need to have my own user record within Salesforce, and I need to have
your service resource.
Right.
Yeah. So it could be anything, right? I mean, you could go with an employee community, I suppose. You're saying an internal user?
Yeah, like I'm not even talking like if there's no communities on the table, and this is just like I'm a physician that needs to be scheduled, but I need to have a user associated to that service resource record. So like with that user record, am I getting like like a platform license or like a? Yeah,
no, platform doesn't work here. I just actually am pulling it up on the side. I'm just gonna link an FAQ that I'm just pulling from, that gives you the full details, because I just pulled this from our internal. Let's see if I can put this in the chat.
And Sam, these are great questions because the biggest challenge, like you said, it's not so much small organizations,
Right.
but when you have really, really large organizations, you know, how
So-
can we make this really meaningful?
Yeah, so here's the licenses, and I'm just pulling this up on the side. The Lightning Scheduler licenses are needed for users that need to be scheduled for appointments. The user must, as a prerequisite, have one of the following user licenses. So there's 1, 2, 3, 4, 5, 6, 7. Sales Cloud, Service Cloud, Lightning CRM, Financial Services Cloud, Health Cloud, Communities. So one of those licenses, and then communities can be however you want. So either they have to have a full Salesforce license, and it says actually as a note, and I thought this as well, the PSL will not be available as an add-on for Salesforce Platform Lightning users.
Okay, they need these core licenses. Okay, that makes complete sense.
Yeah, for some reason it's not letting me post. I'm trying to copy this.
Can you do it in a chat direct to me? It may not be letting it for a general, and then we can publish to everyone.
That's fine.
Just do that, and then I'll redirect.
In
Yeah,
all of this, it's James Murphy. A quick question. In all of this talk about the licensing, it sounds like it's really just for the resource who might be the physician, but the person who's actually making the appointment, like the medical secretary,
Yeah,
they don't need any additional
correct.
licenses. That's correct. Cool.
Yeah.
Yeah, they just need the permission set assigned to them, right?
Exactly, yeah. So they would already have a full Service Cloud user, for example, typically would be the use case in the call center, and then they would just need that permission set aside. There's no license on that end. Any Service Cloud or contact center user could schedule.
Cool. Thanks.
Yeah.
All right.
Thank you for that. I appreciate it.
No, great question, Sam. So there's other questions that have also come in. Samara was asking, can you use groups or queues for this? I'm not so sure what you mean by a group or a queue. The service appointment can be assigned. It's a very specific, like you put it on the calendar. So you're talking about
Yeah,
like
so
a general?
I'll just kind of explain it a little bit. So I'm thinking virtual world today, how if we want to schedule an appointment, because we have more of a call center situation in my use case, there could be 3, 4, 5 different people that would be eligible to do this virtual appointment that we want to schedule. So I was just wondering if we had to schedule, and it kind of sounds like maybe we do have to do a specific user versus if I could put something out there that there was a request for these 5 people.
Assets. Use Lightning Scheduler assets, because then you can put concurrent scheduling on it. So it depends on the structure, but we've been successfully doing that. We're back to COVID testing, that they know that they can handle 4 people every 10 minutes for COVID testing, but we're not sure who's going to be there and doing it. So you use service, you use asset license as a service resource, and you can have 4 asset resources with, you know, the concurrent scheduling, and you can do it that way. Or you can just have 1, and you say, we have an appointment, we need a nutritionist. You know you have an appointment, who you assign someone, but my job through the call center is I'm just scheduling a generic, I need this appointment, I need this resource. But it's not up to us, the call center, to decide who it is. You basically assign someone. Is that what you're saying?
Yes, yeah, that's exactly where I'm going.
Yeah, service resource asset license. If you're just looking at one person, you know, 1 appointment per time slot, is great. And then if you want multiple time slots for that asset, for that appointment type, you can enable concurrent scheduling.
And then in that scenario, if you still need to like schedule to an actual person and have like those resources in there, I believe you can just reschedule from the asset to the resource. Is that right? Like after the appointment's been set?
Yeah, there's multi-resource scheduling too. So you could add additional resources onto that asset. So you could add multiple, right? So if you wanted to add in within, let's say an asset is a room, for example, right? You can go, yeah, if you actually go into this and you schedule that, I don't know if you have it set up in your org, but you should be able to go on and add in additional participants.
Yes, and that's actually, we're getting definitely down in the more advanced. Hold on a second, but you do have this here. Yep. And then you can either an asset or a person, and then this gets really sophisticated really fast. This is an intro overall. We're going to give you all resources where you can go research this later. But yes, there's that. Hopefully that helps you some, or at least get you in the right direction there.
Yeah, I think my one follow-up question was, you said up to 4 per asset. Like if I had a
no, you can have 100. You can have 1,000.
All right, great.
Yeah, there's no limitation. I was just making up for because that was a use case we've done recently. I had with a client. Andy, if you already have them as existing accounts and contacts, you need to recreate them. Yes, because an account and contact is completely separate and completely different than service locations and so forth. You could associate them, but they are completely separate. We had a question, Ryan had a drop, but he did have a question. Could this be used with an Epic integration? You know, Paul, have you seen a EHR integration? I'm sure this has come up before. I know there's not even a scheduling EHR object in Health Cloud. So
it comes up all the time. The APIs aren't really available like on an Epic side. I mean, it's something that comes up a lot. We've had customers get creative with how you create this, but no, I would say at its core, I haven't seen any successfully where you go Lightning Scheduler, send an API call into Epic and schedule it that way. It's just not. Yeah.
And even to the point that if you want to bring over scheduled appointments into Health Cloud, that there's not even an object for it. You actually, I've seen where you create a custom object for appointments for that. That's how much it's not there. So you have to get creative on this. Okay, I think we're caught up on questions. Let's go ahead and pop over here. Well, actually, I apologize. If you go through this, what Corinne was saying, this is great for success. But even so, keep your PowerPoint open, keep your definitions, because even so, when you're starting to build this, it can get a little fuzzy. It happens to all of us in the beginning, and it's quirky, and just because it's new. It's not intuitive. It's a great tool, and I've seen it used multiple times in multiple ways, but there is a learning curve, and it's not you, it's just a learning curve. And I want to, looking at the time, it's 12:38. I want to get into some, for those of you who are familiar with Lightning Scheduler, let's get into some gotchas. Let's get a little bit beyond the basics. So we were talking about concurrent, and concurrent scheduling works with a user resource or an asset resource. And it's basically you have 3 slots. For example, and I say this as fictional example because we all know they overschedule doctor's appointments, but I don't know what their rationale is on that. Right? We all intuitively know this happens. So let's say on average, 1 out of 3 patients will be late or no show. So they want to schedule 3 appointments for 30-minute slots. You can do that with concurrent scheduling. Licenses, user versus asset. This is pulled straight from the Salesforce product catalog. And so this is not like deep secrets here. And yes, there is a publicly available Salesforce product catalog that lists all this. And so the user is 25 per user per month, and asset is 15 per month. Of course, this is between you and your own Salesforce AE. That's just what's published publicly in the product guide. Gotchas. Here's a good one. Salesforce Lightning Scheduler comes with 6 out-of-the-box flows. You can modify to your heart's content, and Salesforce will support you in troubleshooting. When you create the flow from scratch yourself, Salesforce support will not support you with it. So just be aware. You're like, oh, I'll just create my own flow and then I'll use this with Lightning Scheduler. Okay, and you're welcome to do so, but you will not get support. Now, even if that Lightning Scheduler flow no longer looks anywhere like the original, which you won't by the time you're done, they'll still support you, but you got to start from there. Concurrent events do not work well with concurrent scheduling, just a little bit call out. And with concurrent scheduling, you need to have separate operating hours for territory and service territory member for it to work, and it can get a little funky. Michael, what was that one piece of documentation that was not it had a log of case and the support said there wasn't documentation out on this yet?
Yeah, it wasn't crystal clear on the scheduling that when you want to utilize concurrent scheduling, that you need operating hours for the territory, but then you also need the concurrent piece associated to the, I'm making sure I explain this right, to the member, which is a junction between that service territory and that person or asset.
I put this in bold and red because that was a painful, painful process. Authenticated user versus guest, it's doable. Be careful of permissions and security, but it is doable. So you have a community, and the scenario use case is you have a community, but you don't want an authenticated user, i.e. someone wants to get tested for COVID, but it's not a requirement that they have to become authenticated. They don't have to create a login to the community. You can set this up for a guest user. It's just be aware and be very mindful of your security and what you, and test, just test, because you're, just be very careful doing this. I personally advocate for authenticated user versus guest, but it is doable. Any questions on the gotchas? We have Michael and Paul on the line. Anyone else have any other gotchas that you'd want, or Corinne or I can talk to? Let me see questions. Oh, we have any other questions? No? Anyone else have any other questions on gotchas or anything else on design? No? Okay. Coming back to here. So resources, if you're a customer, then there is a Lightning Scheduler help documentation at that link, and then there's also the trailhead. We do have a lot of consultants on the line as well. There is a new Lightning Scheduler trailhead. For the customers who are going, what does the partners have? It's a different version of a trailhead, essentially. And then there's the partner community. And that is it. Any other questions on anything that's related to healthcare overall, using Salesforce in the healthcare arena that you'd like to bring up at this time?
Hi, I have one more question. Sorry, I'm kind of new to Lightning Schedule. This is Laura again.
Hi.
I was wondering if we had to, so you went through setting up territories, setting up skills, and things like that. I was wondering if there's any way that territories, for example, so again, my example would be, it's not quite a call center, but you can kind of think of it as a call center, where they would be, because it's virtual, they need to be in a certain state or a certain territory. Is that something that's optional, or do you have to set up territories and skills and everything that you outlined?
I can answer that. This is Mike. No, you do not. So some of those objects are required to schedule the appointment just to utilize the data structure. But as far as forcing a user to select or to see those, no. So just in any kind of standard Salesforce configuration, or even these specifically being screen flows, you can always. There's a lot of examples recently we've done where it's exact your use cases what you said, where we didn't want the customer or user to go through 7 screens just to click the one territory we had, or to even see it, since it didn't make sense to their use case. So what we would do is we would just default those values and remove them from the screen.
Okay, wonderful. That makes sense.
And that goes back to how much you end up redoing the flows, because you want to bypass that. Any other questions?
It looks like we got some in chat.
Oh, okay, cool. And I just posted a link to where you can, the Salesforce community, the success community, where the link to the deck and the video will be published. And Raphael, did you want to unmute and explain? Oh, you're doing field service sliding for Health Cloud. Would you like to unmute and talk?
Sure, thank you. Hello, guys. We are implementing field service lighting for Health Cloud, and we have a use case where the nursing has to create a new record on the care observation. And I'm wondering if someone did that in the past, and if there is any tip or any concerns we need to be aware about.
Michael, because you have field service Lightning.
Yeah, I'm just trying to think of I'm not following the relationship. So if you're doing a care observation record, are you making it just an association? Is it part of what's being gathered in the scheduling, or kind of where does that fit in? Or is it just something that needs to be related and used at some point?
So the healthcare professional has the appointment, and it is done through the field service licensing. And during the consultation, she has to create a record in the care observation, but she doesn't have a computer, only the FSL mobile app. So
yeah,
working on flows to do that. So, but I want to hear from you guys if someone did that in the past.
Yeah, so if you haven't done a lot of configuration or tried to do a lot of customizations yet with the FSL mobile app, there are definitely limitations to the FSL mobile app, just in general, but even compared to the regular Salesforce app, and then even taking a step further just to Salesforce. So you have to watch the guardrails there, but there's always ways to I would say, get creative to create records. So without having much more detail, I would definitely always say yes, it's possible, but it may not be as user-friendly as you're probably used to building things or automations in Salesforce directly. But, depending on what type of information you're gathering and how, how many fields and what the data looks like, you could, run into some obstacles, but there's always a way around it. It just may not look as pretty as an end result. But in FSL mobile app, you can support screen flows and quick actions. So even just with those two immediate, thoughts, I think the screen flow is probably the direction you'd want to go, but without hearing more. But
I have a follow-up on that, Michael, from another person. Really, the comparison between field service Lightning and Lightning Scheduler, and I think you already touched on that, is when you're scheduling someone. If Sally is a home health nurse and you need to schedule her to go to a certain address, you need to track, and she's checking in, I think that's a clear use case for FSL versus Lightning Scheduler. You're just scheduling. Or what would you say are other differences between the two for decisions? Between comparing field service Lightning as well as Lightning Scheduler?
Is that a question for me?
Uh-huh.
Oh, sorry.
I know.
Yeah, so the way I would describe it, because field service Lightning is there's a lot more functionality in there. It has its own app, and I would say the Lightning Scheduler is really just a piece of field service pulled out, and utilized just for scheduling, where, field service Lightning has an array of use cases, getting into, dispatcher consoles and those types of use cases. So I would definitely say there really are two separate things, even though the scheduling piece is very similar.
I would say there's also there's a few other considerations. You mentioned the dispatch and the Gantt view. Mm-hmm. Obviously, travel is a big one. I mean, when you think field service Lightning, you also can think, do they need access to that work order parts, inventory, van stock, all from a mobile device? Exactly. You can think, is there any type of aspect of crew management or contractors that need to go into it? There's a full list. It's probably it could be its own session in itself, honestly, as far as how we make that evaluation. And there's certain times where customers just want to do custom things, and we run into it all the time where there's a blend, right? We sometimes go out in the field, and we're sometimes at a location, and it's very situationally based, and it depends on the complexity and the nature of each individual use case.
Thank you for that follow-up, because I mean, it's a great question, and as we more and more get into Salesforce is being used by healthcare companies, and they have such a mobile group and mobile man force, especially when we get past COVID times and we get more actively out there, what makes the most sense. Looking at our last remaining 10 minutes, I do want to point out, we have a couple of things I want to point out and then we can take some more questions for the last couple of minutes. But December 2020, we're taking a break. It's the holidays, so we're not going to have a user group. And in January, we're going to have healthcare forums and surveys, i.e. assessments in Health Cloud. We're going to talk about that, the pros and cons, what makes sense to happen. And then we're also going to have a vendor form stack there as well, talking about being HIPAA compliant and so forth. Just look at all your different options that you have. And then February, we have Salesforce security from HIPAA and Shield. And we are, just like Paul, thank you again so much for being here. We're also going to have someone from the HIPAA team, the Shield team, going to be here to, on the call to help answer questions. More of a future roadmap process. You still can register from SFDC Health, which is simply a simple and fast way to get you to the actual page, because it's really hard to tell everyone to go to this long URL. So when you go here, you can sign up. And then also, this is to send an email to contact Corinne, Mel, and myself. And this link here takes you to the Success Community, where we will be posting the links, which I put the link in the chat, but this is where you need to go. If you're not currently a member, please do become one. We end up posting information in here as well. So that's my wrap up there. Any other questions? No, I don't see any. Paul, thank you again so much for being here. I really appreciate it. I know our guests appreciate it. Michael, your expertise, and also having the field service Lightning Scheduler. I really appreciate it. And as always, Corinne as my co-leader, and Mel, who's not here physically, but here with us in spirit. We really have been, just love doing this and reaching out to the community. And I appreciate Michael and Paul, you being here, as well as you all. Please let us know of any other topics that you wish to discuss in December. Mel, Corinne, and I are getting together. We're going to be evaluating what we want to discuss beyond these meetings for next year. Also, we want to see about the time. There has been a lot of people asking for the time to be moved more to like 5 or 6 o'clock Eastern. Corinne is on West Coast, I'm East Coast. If you have any more feedback on times, it's never going to be perfect, but we can also take that into consideration. Corinne, what else do we want to know other than suggestions for meetings? Is there anything else that we want to ask of our members?
I mean, you covered pretty much everything. I'm excited to get into the next couple of meetings. Everyone has like good questions, and I think some of my favorite questions are around like specific use cases that everyone has. So I think like kind of thinking about, you know, if there's any unique scenarios that you're coming across, or there's like specific questions around how you're going to execute a certain thing related to Health Cloud, like those are amazing questions, and I love having those discussions. So just kind of keep that kind of stuff coming, I guess.
Yeah, and they can do it in the community. So we do watch the community. So if you want to do it, you know, Andy, I'm sorry, you always will win the time zone war. I know that it's 5 a.m. when you join us in the morning, and you don't complain, which is wonderful. And we should refer everyone to you that you don't complain. But there's people who are like, they would prefer we didn't have it in the middle of the day.
Like, yeah,
all right.
Flexible though.
Yeah, exactly. All right, last chance for a question before we say goodbye. Anything else? No? All right, thank you guys. Happy Thanksgiving for those of you in the US who celebrate Thanksgiving. Happy Thanksgiving next week. And if you need us, reach out to us through the community. Thanks, everyone.
Thanks, guys.